When recovering from an injury or a medical condition, there is no place better to do so than your own home, right? Here to tell us what Home Rehab Express can do for you or a loved one is Joanne Ellis with Home Rehab Express once again, and Dr. Peter Curcione, an orthopedic surgeon. Good morning. Welcome back.
Thanks
All right,
again.
this morning we're talking about the hip and hip replacement surgery, which I know is very common, certainly in this area. But Joanne, first talk about Home Rehab Express, and how do you explain what it is for those who are just now finding out about you?
Sure. Home Rehab Express is a home health company, and we provide in-home nursing and physical therapy services to patients that are either recently discharged from the hospital, like in Dr. Curcione's case, or patients that are just needing extra medical attention and cannot make it to the doctors all the time.
Yeah, so you can have that, the benefits of the hospital staff and the nursing at your own home, which is fabulous. Like you said, you've worked with a lot of different doctors over the area, and that is why you've brought Dr. Peter Curcione here this morning. And so let's talk about the hip replacement and kind of, again, is it a pretty common procedure from what I'm assuming here in our area? Do you see this more often than not?
Extremely common operation, especially in the demographic that we have here in Southwest Florida, but even throughout the country. It's a very, very, very common operation.
Well, and we're going to talk this morning about this anterior approach when you have this done, and it's basically, from what I understand from you, doctor, it's kind of where you're going in, when you're actually going in to do the surgery, how you're going to actually get the replacement done.
That's correct.
So explain a little bit more what that is.
So the traditional operation, and what the majority of orthopedic surgeons in the country do, is an incision on the side of the hip. You have to take down and go through some muscle tissue that has to be disrupted. Well, the direct anterior approach kind of eliminates that process. You're going through the front of the hip so that in the end you have a more stable hip replacement. It reduces the rate for dislocation, but more importantly, you're just moving muscles away and going through a muscle plane rather than through a muscle.
Do you always use that approach, or does it kind of just, is it based on, you know, the person coming in and...
Yes, more and more people are asking for it because it's gaining more traction. It's a more difficult approach, so you have to have experience with the operation.
And as far as recovery time, you were saying that it actually kind of on the short end, you know, there's some benefits there.
The main thing to know about the direct anterior approach is that short term is where you really get the improvement. Because you're not disrupting the muscle. Those first 3 to 4 weeks after the operation are a lot more comfortable for the patient. Long-term results don't show any difference between doing it a more traditional, minimally invasive way or through a direct anterior minimally invasive
But again,
surgery.
if it helps that recovery right after surgery, I'll take it. That's where I want to do. Yeah, very interesting. Well, if people want to find out more, they want to find out more about Home Rehab Express, what would you have them do, Joanne?
I would have them look at our website, homerehabexpress.com, and also call Dr. Curcione's office, which I think the number will flash up.
Awesome. Well, thank you both so much this morning. Very interesting to speak with you this morning, and we look forward to having you back, Joanne.
All right.